In the recent era, malignancies have been notoriously increasing and has become the second most common cause of death worldwide, most common cause being the cardiac arrest. Surprisingly, the investigations and the diagnostic protocols for malignancies have been acutely changing in this era. Here I am going to present about 4 gentlemen who have been recently diagnosed as renal cell carcinoma and they came for CT PET for staging. I am going to give the X-ray pelvis of the 4 patients. Please analyze the picture and think about the respective diagnosis. I'll give one hint. One of the 4 is perfectly normal, right? One of the 4 X-ray pelvis is perfectly normal. Now what you have to do is to find out the normal one and give the diagnosis in rest of the 3. If you want more time, please pause the video and review again to assess the images. Within few seconds, I'll give you the findings and the differential diagnosis and the final diagnosis. Are you ready? Let's go. The first one shows a small, nearly round sclerotic nodule in the left side of bony pelvis above the acetabulum, which is suggestive of bone island, also known as anastosis, which usually shows no uptake on PET or any radionuclide studies. The differential diagnosis for this is osteoma, which can be seen anywhere in the bony skeleton but is usually uncommon in bony pelvis, which will be negative in the PET or any radionuclide study. The second differential diagnosis for this is solitary sclerotic bony metastasis, which will be positive on PET or any radionuclide study. Now the final diagnosis is bone island, which is otherwise called as anastosis. We'll go to the second case, which shows altered sclerotic changes in the right side of bony pubis and the ischium. On PET, there was no uptake, but biopsy was done as nuclear physician could not rule out malignancy. The biopsy revealed sclerotic bony dystrophy, with my pathologist diagnosed it as maloriostosis, which is also called as Lery's disease or limb flowing sclerotic bone dystrophy. On X-rays, they have characteristic signs: wax flowing down a candle or candle greasing appearance or dripping wax appearance. It usually affects the appendicular skeleton and is very less common to affect the axial skeleton in this case. As in our case, it is always monostatic. That means only one part of the bone is affected and is never bilateral. Sometimes radionuclide study shows some uptake in some few cases. Here the final diagnosis is maloriostosis, or otherwise called as Lery's disease. Now we'll go to the third image, which is of a 13-year-old boy, not a gentleman, he's a gentle boy who had a RCC. His X-ray pelvis shows diffuse symmetric distribution of multiple small sclerotic nodules in the lower half of bony pelvis, including the acetabulum and the bilateral upper femur. The diagnosis is very characteristic of osteopoikilosis, which is also called as spotted bone disease or disseminated osteopathia condensans. A lot of DDs can be there. One is the most common, the sclerotic metastasis. Then the second one is tuberous sclerosis. Third one, mastocytosis. Fourth, synovial chondromatosis, and go on. But osteopoikilosis is always bilateral and symmetric in most of the times, especially in radionuclide studies, and is usually an easy diagnosis in experienced radiologists and even in exam goers. So the final diagnosis is osteopoikilosis. The fourth image, I have already mentioned that it is the normal appearance of X-ray pelvis, right? I am giving the table comparing the 3 DDs, bone island, maloriostosis and osteopoikilosis. Already I have discussed here. Please pause the video to read this in detail. Now finally, the purpose of this quiz is to emphasize the importance of X-ray appearances in bones, which can be benign or it can be normal variants in known malignancies, especially in renal or lung or breast malignancies. In our case, the first 3 ones are the old X-rays done few years back, and the clinicians were very sure that they were benign, but they want to confirm it by other studies like PET. Here you can give your opinions, especially about your way of thinking and experience in such similar cases you have encountered. I have already given a RCC case of a 21-year-old boy previously. You can click there and review it. If you are interested in the other quizzes, you can click the blue colored R button to see rest of the quiz list. You can click and go through the quizzes if you are interested. Thank you very much for your patient hearing. Bye bye and take care.